Hello everyone, my name is Eli González and I'm a doctor. I'm a neonatologist and I'm gonna share to you my experience as a neonatologist. As a graduate of the National University of El Salvador's School of Medicine and a neonatologist who completed my specialty training there, and I'm honored to share my experiences with you. My education at the National University of El Salvador's School of Medicine provide a strong foundation in medical knowledge and clinical skills. The curriculum was so comprehensive and rigorous, but now I'm here and I love my work. I love to be a neonatology just, and I hope you like my specialty, and I'm gonna try to share to you my experience, and I hope it can help you to choose my specialty. After completing my general medical education, I decided to pursue a specialty in neonatology. The field of neonatology involves caring the newborn infants who require specialized medical attention. And I was drawn to the idea of providing care and support to most vulnerable patients, the newborn infant. As an neonatologist, I care babies, who are born prematurely, have medical problems at birth, or require specialized care in the in the first few weeks or a few months of life. These babies often require advanced medical care and attention, including specialized monitoring, medical management, and sometimes even surgery. Our goal is to provide the best possible care to these babies to ensure they can have the best change of a healthy life. One of the most important of my work is communication with families. When a baby is born with medical issues or requires a specialized care, it can be a stressful or an emotional time for parents. So we work closely with families to provide information, provide support and guidance as they navigate the challenges of caring for a newborn with medical needs. We also provide care for babies who require a specialized follow-up care after leaving the hospital. This includes developmental assessment, feeding evaluations, and other services to ensure that these babies continue to thrive and grow. Now I'm working in San Juan de Dios Hospital here in El Salvador, and it is so amazing, grateful, and fantastic because I can work for my people, the people of my country. I decide to study, to work, and stay in El Salvador to help my people, the people of my country. I think is the most important thing of my work. Help the people of my country. So let's talk about the important role that instruments play in the field of the neonatology. As a neonatology, I am very intimately and familiar with the tools that we use to provide the best possible care for the smallest and the most fragile patients. One of the most essential things is my uniform. The uniform is very important because parents or people in the hospital can recognize to us. I mean, we are the doctors, we are wearing a uniform, and they can make sure that we're gonna help them. And my uniform, I think, is very important. Um, Other essential instrument that we use is the incubator. The incubator is this, you can see. This device allows to provide a warm, a stable environment for premature and sick newborns, helping to regulate their temperature, humidity, oxygen levels. The incubator is very important and because also provides a safe space for medical procedures. And it is an essential tool that we rely on every day in our work. Another crucial piece of equipment that we use is the ventilator. This is very important. Sometimes when premature and sick newborns often have underdeveloped lungs, and they need assistance with breathing to help them get enough oxygen. For example, when a baby when lungs are undeveloped, the ventilator provides the support, helping to regulate the pressure in the lungs and ensure that these tiny patients can breathe comfortably. Other instruments that we use on a regular basis include hair monitors. It helps us to make sure that the beats are normal beats, and pulse oximeters. It helps us to know when a baby isn't breathing the best way, and blood pressure cough is other thing very important to care the babies. You can see all them, and these tools help us to track vital signs and detect any changes, any changes that may require medical intervention. By closely monitoring these indicators, we can ensure that newborns receive prompt treatment when they need it. These instruments help us to know in the time the baby need the prompt treatment, and that we can stay ahead of any potential complication. It's very important because it's different with adults and babies. Youngest people need help, and it's so complicated to not have. If we don't have these instruments, we can help these babies, and these instruments are very, very important. And finally, I think other thing is very important. It's not like instrument, but I want to mention the importance of teamwork and collaboration in the neonatology space. It's very important because it is a team, and we work with nurses and other doctors and people that also care the babies, and it is very important the teamwork because we are a team, we are a group, and we we are trying to make sure that babies are safe, and it's very important to work in a team, you know, and work in the best way, you know. One of the most important treatments that we provide is specialized nutrition. It is very important. Premature and sick newborns often have underdeveloped digestive system and require careful monitoring to ensure that they are receiving the proper nutrients. We also use a range of specialized um, formulas and feeding strategies to help these babies get the nutrition that they need to grow, to grow and develop. Um, Another critical of neonatal care is medication. Medication. We use a range of drugs to treat a variety of conditions, including antibiotics to treat infections, for example, pain medication to manage discomfort. We also use medication to regulate blood pressure and heart rate. We work closely with pharmacists, and we are close of other specialists, you know, to ensure that our patients receive the right medication in the right doses. You know, these two treatments are the most important: the specialized nutrition and the neonatal care. I mean medication. You know, so drugs and are very important, and specialized nutrition for babies are very important because it can help the baby to stay healthy. I mean, talking about infection, pain, and other diseases that can hurt baby. You know, I'm working in the plan Nacer con Cariño. It's like born safe, you know, in English. And Nacer con Cariño is a project. It's very important because we're working to make sure that babies are getting the best care in the hospital with their mother and the father. They are very important. The parents are very important to care the baby, and we are the personal that have the responsibility to make sure that it made we can make it a reality in a baby's life, you know. So working like a neonatologist, I have a lot of experiences and a lot of stories, and I know a lot of babies, and they are very important to me because I get experience, and I'm gonna talk to you about my first patients. I remember when I was young, I was so stressful the first day in the hospital. I was so scared, stressful, and I was like, I'm not sure to stay here, but I was so excited at the same time because it was my first day in the hospital. And I remember my first patient. He was a little boy, a baby, who was born several weeks premature. You know, it was a premature baby. He was so small. that he could fit in the palm of my hand, you know. And I remember that feeling. I feeling a mix of excitement and anxiety as I began his care in the neonatal intensive care unit, you know, in the NICU. Over the course of several weeks, we provide rounds, the clock care to this little boy, and monitoring his vital signs, providing specialized nutrition, and administering medications and treatments as needed. And we also worked closely with this family because providing education is very important, and support the family is very important to help feel involved in his care, you know. It's very important that the parents feel involved in the care of the baby. I mean, it is a very important thing in the project Nacer con Cariño, and empowered to make a decision about the treatment, you know. We are the doctors, but the parents are who decide if they we apply a treatment to the baby, you know. And I remember his face. He was a little baby. This baby showed me resilience and determination. His progress was so slow but steady, I remember, and I was overjoyed to watch him grow and thrive under our care. You know, when it was finally time for him to go home, I remember feeling an overwhelming sense of pride and gratitude. It was my first case. It wasn't just a case, because he was my first patient, and I think is the most important experience, the experience that you get at the first time working in a hospital. It's very important, and you are gonna remember that for all life, you know. And I remember him, and I hope I know that he right now is probably a teenager, or he is taller than my palm and bigger than my palm, and I know he's with her family, and I hope one day he can be grateful of the care that hospital and his parents make for him. In closing, I would like to say that being a neonatologist is not just a job, it is a calling, you know. And every day we have the opportunity to make a positive impact on the life of our teeniest patients and their families. It is a privilege to be a part of their care, and you know, to witness the incredible resilience and strength of these babies. And so thank you for allowing me to share a small glimpse into the world of neonatal care.